going, and it's going to be a long conversation and detailed conversation,
well,
obviously.
Think what you may about Senator Kenney's plan, but you got to appreciate that guy's moxie of working through his illness. Thank you very much, Peter. There are a number of physicians, by the way, who've taken a sabbatical to serve in Congress. Among them is our next guest. He's a Republican congressman from the state of Louisiana, Charles Boustany. He is a former cardiothoracic surgeon. You got to tell me what that is, doctor. First of all, I guess you're actually doing the surgery, right?
That's right, David. I used to do open heart surgery and lung cancer surgery.
Okay.
And, you know, with 20 years experience doing critical surgeries like that, open heart surgery, I know that if we're going to fix health care, you have to focus on quality, because high-quality medicine brings usually with it the lowest cost. And that all focuses on the doctor-patient relationship.
Well, and as we know in economics, the way you get the lower costs is by having competition. And what is of concern to a lot of us is that the government's plan might squeeze out the competition of the private sector. Is there a way to get the best health care there is for the American people out there without squeezing out the competition?
Well, there clearly is a way to do that, and that's what House Republicans are working on. We've got a number of proposals that are in draft form that we hope to bring forward very soon. But let me say this, if we do go the route that the administration is pushing and that congressional Democrats are pushing for, that is a government-run bureaucracy, it is going to push people off of private insurance, it's going to create waiting lines, and it's going to hurt access to doctors. We already have access problems in Medicare and Medicaid, so creating a third new government program is really not the way to go.
Well, let me just ask you about the analogy I made earlier about how I actually do remember. I was a kid at the time, probably no more than 5 or 6 years old, but I remember the doctor coming to our house for a house call, fixing whoever it was that was sick or doing his best to do that. My father accompanying him to the front door, where my father pulled out a $10 bill or whatever it was, gave it to the doctor. Is that just, you know, a pipe dream to think that we could ever get something like that to happen again?
You know, David, I remember those days as well. My father was a family doctor, and I used to accompany him on rounds like that to family homes to take care of patients. And that's what I'm talking about with the doctor-patient relationship. You've got nothing between the patient and the doctor.
Right.
And
well, how do you do that? Let me just stop you right there, Congressman.
Yeah.
How do you do that? How do you get out the middle? Because, you know, frankly, a lot of these problems began when we increased the size of government intervention through Medicaid and Medicare back in the 60s and 70s and 80s. So this has been a problem that's been building, and then the insurance companies compounded it with their own red tape. How do you get out the middleman?
Well, the two things that we need to do are create a wide range of choices that allow all kinds of options for folks to get their own health insurance, and put families and patients back in control of their health care destiny and create real portability. You've got your health care. Nobody can take it away from you. You can take it from job to job. And that's what we need to get back to.
Now, I got to say that, you know, the conservatives will argue that we don't want more bureaucracy. We don't want more middlemen, a bigger bureaucracy in the middle crowding out competition. Liberal Democrats will say we don't want greedy hospitals, greedy insurers, greedy doctors. And I got to we've given credence to the conservative argument, but to the liberal argument, you know, that doctor that came to my door, he wasn't a rich man. He was driving a second-hand car. A lot of his bags and medical equipment were, you know, first or second generation equipment. I mean, times have changed for what the doctors, the business of doctoring has become a multi-million-dollar business on an individual level. Is that right? Do doctors have to get back to their Hippocratic oath of almost a vow of poverty in what they do?
Well, nobody wants to see anybody impoverished, and let's keep in mind that getting a medical education is a very expensive endeavor. And most young doctors coming out to start practice have high levels of debt because of the high cost of tuition to go through medical school.
Understood. But, Congressman, what I'm talking about is greed. What I'm talking about, I've seen a lot of medical schools, and there are a number of doctors that really have the fire and the passion to be doctors and nothing else, but there is also a greed element. Is there a way to somehow get that out of the equation?
Well, I think one of the things that needs to be done from a reform standpoint is help realign incentives for health rather than just treating sickness as it comes about and billing procedure by procedure by procedure, because that gets very expensive. We need to focus more strategically on how do you promote health and coordinate physician care, and I think those are kinds of reforms that Republicans are advocating.
By the way, we haven't even begun to talk about the fight between lawyers and doctors. We'll do so with our next guest, Congressman Charles Boustany. Thank you very much, Congressman. Appreciate it.
Really good to be with you. Thanks.
Well, are there examples of health care functioning as a healthy component of our free market system? In a recent speech, President Obama singled out the Mayo Clinic as providing top quality health care at half the cost. Joining us from Minneapolis is Kent Seltman, who just retired as marketing chair for the Mayo Clinic and is co-author of Management Lessons from the Mayo Clinic. Kent Seltman, good to see you. Thanks for being here.
Well, it's a pleasure to be here. Thank you.
So how do you guys do it? We were just talking to the congressman about how to get the most competitive system we can and yet keep